Hello, I'm Adam, an active duty Air Force medic. I'm going to teach you the procedures for administering medications via the intravenous route. This is done in the tactical field care phase when a casualty with established IV access requires the administration of IV medications. Consider body substance isolation. If a combat lifesaver is available, direct them to assist. Check to ensure that the casualty has no known drug allergies to the medications being administered. Ask the casualty or locate their red allergy dog tag or bracelet. Gather all needed supplies and necessary medications. Check the IV line for patency. Assess the IV insertion site for redness, swelling, increased or decreased temperature, or bleeding. If any of these conditions are present, do not use this IV to administer the medication and establish a new IV access point before proceeding. Next, verify the 5 rights of medication administration: the right patient, the right medication, the right dose and concentration, the right time, and the right route. Select an appropriate needle length. Select an appropriate syringe. Connect the needle and syringe. Inspect both the needle and syringe for any defects. Select and prepare the medication for IV injection. Vials that contain a powdered medication must be reconstituted according to the manufacturer's guidelines by injecting the proper solution into the vial instead of air, and then gently shaking or swirling the solution to ensure complete dissolution of the medication before drawing it into the syringe. Pop off the plastic cap on the top of the medication vial. Then wipe the top of the medication vial with an alcohol or povidone iodine pad. Remove the cap from the needle and pull back on the plunger to draw air into the syringe, equivalent to the recommended amount of medication to be administered. With your non-dominant hand, hold the medication vial and insert the needle into the soft rubber portion of the medication vial. Start at a 45-degree angle with the needle bevel up. Change the angle to a 90-degree angle as the needle pushes through the rubber. While holding the vial and the syringe together, invert them and bring them to eye level. Take special care not to contaminate the syringe tip and the needle. Inject the air into the medication vial. Withdraw the appropriate amount of fluid from the vial by drawing back slowly on the syringe plunger until the correct medication volume is obtained. Make sure to keep the needle tip submerged or you'll withdraw air into the syringe. Check the syringe for air bubbles. If air bubbles are present, tap or flick the syringe with your finger to release the air bubbles and then eject the air. Adjust the needle tip to below the level of the fluid and withdraw more fluid until the desired volume is reached. Withdraw the needle from the vial, taking care not to contaminate the needle tip. Now clean the IV injection port with an alcohol or povidone iodine pad. Pinch the IV line to stop the flow of IV fluid if fluids are being infused. Insert the needle into the IV port and administer the medication. Withdraw the needle. Open the IV line to flush the line or flush with 10 ml of an appropriate fluid. Dispose of the expended needle and syringe appropriately in a sharp container. Monitor the casualty for signs and symptoms of allergic or unusual reactions. Document all findings and treatments on a DD Form 1380 TC3 casualty card and attach it to the casualty.